Hi, I'm Deanna Cerlanek, and I'm a physical therapist at our Baldwinsville location. In last week's blog post on our website, we spoke about what Parkinson's disease is, the symptoms, along with different treatment techniques. Just for a brief review, Parkinson's disease is a neurologic disorder in which a part of the brain, the basal ganglia, is affected. The basal ganglia is important for regulating your movements. Thus, for a patient with Parkinson's disease, they may experience slowness of movements, small movements, and even shuffling feet and tremors, just to name a few symptoms. One of the exercise techniques used for Parkinson's disease is large amplitude movements. Large amplitude movements training is used as it is one way to bypass the affected basal ganglia, and it can lead to changes in one's speed, force, and even the amplitude of movement. Today, I will be going through 3 different exercises that can be completed at home in order to promote these large amplitude movements, while also helping to improve posture and even strengthen the arms, the legs, core, and trunk. Please do not complete these activities if you have any difficulties with your balance. Patients with Parkinson's disease often experience rigidity of the trunk or stiffness of those trunk muscles. This next exercise is really going to help to promote nice upright posture, open up the chest and shoulders, while also strengthening the core and the trunk musculature. To start off, you'll need a chair without armrests, and we're going to come and scooch forward in our chair so our back isn't supported. Now, it's really important that we focus on big and large movements. So to start off, we're going to sit nice and big with our legs nice and far apart, and we're going to sit up nice and tall. From here, with nice big arm movements, we're going to come back like you're squeezing your shoulder blades together. And then we're going to end here. So back big, really reach, squeeze those shoulder blades together to our starting position. Back, reach, 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 and together. We're going to complete this for a total of 10 reps, and you can complete a total of 3 sets with this exercise. With Parkinson's disease, a lot of patients are going to have small, little shuffling steps. So the goal of this next exercise is to really work on taking big and large steps. So for this exercise, for level 1, you're going to come forward in your chair, sit up nice and tall, and as usual, let's have this nice wide stance of our legs. So this exercise is going to be completed on both legs. We're going to start with our left leg though. So as we're taking a step forward with our left leg, we're also going to reach back and sit up nice and tall. So just like this. Step and back. Out big, back big. Out big, back big. So after you do about 10 repetitions on this leg, switch to your other leg. Big steps out and back, out and back. Both of these can be completed for 10 reps for 3 sets on both legs. This next exercise is going to work on sit to stands. Now with sit to stands, it's really important to get your nose over your toes or leaning forward before you stand up. Now with Parkinson's disease, this is often difficult due to the rigidity or the stiffness of one's trunk, but also because of the small shuffling movements that a patient may experience. So this exercise is really going to work not only on your balance required for the sit to stands, but also your strength and really promoting a nice weight shift forward to get that nose over your toes. So you're going to come forward in your chair so your back isn't supported. And once again, we want to have a nice, big sitting posture. So bring those legs apart, sit up nice and tall, and we're first going to start by reaching back big, really squeezing those shoulder blades together. From here, we're then going to reach down to the floor big. Really reach, 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 try to touch that floor. And then from here, we're coming back big, squeezing those shoulder blades together. So let's do that again. Reach back big, touch the floor down, reach, reach, reach big, back big, nice big posture, and at the beginning again. So this can also be completed for 10 repetitions of 3 sets.